Puffy ankles after 60 aren't a heart issue. Your lymph system is the real culprit, and this bedtime routine fixes it. Try something right now. Pull off one sock, just one. Look at the skin where the elastic band pressed against your leg all day. If there's a visible groove still indented into your calf, a channel that lingers for 30 seconds, a minute, sometimes several minutes before the skin finally levels out again, stay with me. Because what you're looking at isn't caused by your socks. It's not about salt intake, and despite what the majority of people over 60 have been led to believe, in roughly 70% of cases, it's not a heart issue either. It's a drainage issue, and the system responsible is one that nobody ever properly explained to you. The fluid is already sitting in your leg right now, possibly half a liter, possibly a full liter, quietly pooled in the tissue around your ankle and calf while you went about your day. And tonight, once you lie down, that fluid is going to do something to your body that disrupts your sleep, puts strain on your heart, and speeds up every other health challenge you're already dealing with. Let me walk you through exactly what's happening inside that ankle, and the 5-minute evening habit that clears it out before bed. Subscribe to Dr. Chen. We're working toward 100,000 subscribers, and every person who joins increases the chances that the next person who truly needs this finds it. You know the moment I'm describing. You get home, kick off your shoes, and there they are. Ankles that look noticeably fuller than they did this morning. Calves that feel dense and heavy. Rings on your fingers that suddenly won't budge. You push your thumb into the skin just above the ankle bone, and watch it leave a pale indent that takes an eternity to bounce back. You stand up after sitting on the couch for a while, and your legs feel like they've been filled with wet cement while you weren't paying attention. And when you bring this up at a doctor's visit, what typically happens? You get questioned about your heart, told to reduce sodium, and handed a prescription for a diuretic, a pill that has you rushing to the bathroom all day. For some people, that brings minor relief. For most people over 60, it barely makes a dent. Because the fluid was never in the bloodstream to begin with. It was in the tissues, and a diuretic doesn't reach tissues. It only pulls fluid from the blood. So the wrong compartment has been treated all along. Let me explain what's actually going on. Your body has two separate drainage systems, not one. Most people only know about the first, blood. Arteries delivering fresh blood outward, veins carrying used blood back to the heart. That system has a dedicated pump, your heart, which operates automatically every moment of your life without any effort from you. The second system is called the lymphatic system. And here is what no one ever clearly laid out for you. It has no pump. None at all. Lymph is a pale, clear fluid that continuously seeps from the tiny blood vessels running through your tissues, surrounding your cells, collecting cellular waste, dead bacteria, excess proteins, and excess water. It then needs to be returned to the bloodstream through a completely separate network of vessels called lymph capillaries and lymph ducts. Around 2 liters of it each day. But those lymph vessels have nothing driving them. They move only when your body moves. Picture your lymph system as a conveyor belt that only operates when you put it to work. Every step you take, every time your calf muscles contract, every ankle flex squeezes those vessels and pushes the fluid upward. Stop moving and drainage stops too. Sit for 3 hours and the belt goes completely still. The fluid just settles in your ankles, doing nothing. When you're 30, this doesn't create a serious issue. The lymph vessels are supple. The valves inside them are firm and responsive. A short walk across a parking lot gets the whole system back online within minutes. But after 63 things shift simultaneously. The lymph vessels become stiffer. The valves begin to weaken. And the connective tissue around the ankles that keeps everything structured starts losing its own resilience. Fluid seeps out faster, and the system clears it more slowly. The equation stops balancing, and the reservoir builds up. Before continuing, I need to stop and draw a clear boundary. There are situations where ankle swelling is not a lymph issue, and is a genuine medical emergency. Please recognize these, pause this video, and see a doctor today if any of the following apply. One leg suddenly becomes dramatically more swollen than the other within a few hours, and it's painful, warm, and red. That may indicate a deep vein blood clot. It's serious. Get seen immediately. Both legs are swelling and you're having difficulty breathing, especially when lying flat. You're waking up gasping. You can't manage a flight of stairs without stopping. That pattern suggests significant cardiac strain that has moved beyond early stages. Not something to manage at home. Swelling accompanied by sudden weight gain of 4 or 5 pounds within a week, combined with foamy urine. That pairing suggests the kidneys are losing protein. That requires blood work this week, not sometime next month. Swelling on one side only, painless, firm to the touch, in someone with a history of cancer treatment in that area, may point to lymph node blockage requiring evaluation. If none of those describe your situation, if your swelling comes on gradually, affects both legs equally, worsens by evening, improves by morning, and you have no breathing difficulty at rest, then the information I'm about to share is relevant to you. There are essentially 3 patterns of chronic lower leg swelling after 60. They appear similar visually but have completely different underlying causes. Pattern 1 is venous. Your veins are struggling to return blood toward the heart. Valves within the veins have failed. Blood pools, pressure builds, and water is pushed out through vessel walls. You'll typically notice visible varicose veins, brownish discoloration on the shin just above the ankle, and swelling that becomes drastically worse after a day spent mostly standing. Pattern 2 is lymphatic. This is the one we're focusing on today. Lymph flow has slowed down. The tissue is waterlogged. The swelling is soft, leaves an indentation when pressed, feels puffy rather than tight, and frequently involves the top of the foot, right behind the toes. When lymphatic swelling has persisted for years, the skin on top of the foot becomes so dense you can't pinch it between your fingers. That's a clinical indicator, and it points directly toward lymph, not veins. Pattern 3 is cardiac or renal. Your heart or kidneys aren't managing fluid properly. The swelling is symmetrical, progresses throughout the day, and crucially, it comes alongside other symptoms. Shortness of breath, waking multiple times to urinate, profound fatigue, rapid weight gain. If those accompany your swelling, you're in pattern 3, and this isn't something to handle at home. You need a proper medical workup. Most people over 60 dealing with chronic evening ankle swelling, and no other symptoms fall into pattern 2 lymph. Let me tell you about someone I'll call Dorothy. 68 years old, lived in the same home for 30 years, a retired schoolteacher. She walked into a clinic certain her heart was giving out. Her story unfolded like this. Over the course of 2 years, her ankles had been thickening by evening, at first just slightly, then enough that her regular shoes no longer fit. She bought wider ones. The swelling continued. She raised it at a checkup and an echocardiogram was ordered. The heart appeared perfectly healthy. Ejection fraction was 62%, entirely within normal range. But Dorothy was still swelling. A diuretic was prescribed. 6 months later, she was constantly running to the bathroom. The ankle swelling had barely shifted. She was worn out, dehydrated, and still puffing up. She eventually said one thing that changed everything. Strangely, when I travel and spend the day on my feet, my ankles are actually better. That was the key. Her swelling improved with movement. It worsened with sitting still. Her heart was healthy, her kidneys were healthy, and a venous ultrasound showed only mild age-related findings. What Dorothy had was a lymphatic drainage problem that no medication could resolve, because the fluid wasn't in her bloodstream. It was in her tissues. Here's what happens inside Dorothy's body every single day, and probably yours too. She wakes up. Ankles look thin. She's been lying flat for 8 hours. Gravity wasn't pulling fluid into her legs, and her lymph system had the entire night to mostly clear the previous day's accumulation. By morning, she's nearly back to baseline. She gets up, has breakfast, sits at the kitchen table for an hour, drives for 20 minutes, sits at her volunteer station for 3 hours, has lunch, sits again. By 2 in the afternoon, she's been upright but largely stationary for 7 hours. Fluid has been steadily seeping from her capillaries into the tissue of her lower legs the entire time. Her calf muscles have barely activated. The lymph conveyor belt has barely turned. The fluid is simply accumulating quietly, a small amount at a time, into a reservoir she can't see. By evening, the sock groove has appeared. By 9, the ring on her finger is snug. By 10, she lies down, and now the real trouble starts. All that fluid that accumulated in her ankles, now that gravity is no longer holding it downward, begins slowly reabsorbing back into her bloodstream. Her heart receives an unexpected surge. Her kidneys detect the increased volume and kick into high gear, producing urine. She wakes at 2 in the morning, again at 4, again at 5. By 6, she's already exhausted. The cycle starts over. 2 tests. Right now, 30 seconds total. Test 1, the pit test. Locate the bony ridge along the front of your shin, about 4 inches above the ankle. Press your thumb firmly into the tissue there. Hold for 15 seconds. Release and observe. If a visible indentation remains and takes 10 seconds or longer to smooth out, you have what clinicians call pitting edema. Grade 1 is a slight depression. Grade 2 is deeper and longer lasting. Grade 3 leaves a deep indent that persists over a minute. Note your grade mentally. Retest in 2 weeks after following the protocol, and the difference will be measurable. Test 2, the foot skin pinch. Try to pinch the skin on the top of your foot just behind the second toe between your thumb and forefinger. If you can easily lift the skin into a fold, your lymph is moving adequately. If you can't lift the skin at all, if it feels fixed to the underlying foot, you have more advanced lymphatic congestion. This is called a positive stemmer sign, and it's one of the most straightforward clinical indicators of chronic lymph saturation there is. 3 things that make lymphatic swelling worse. Most people over 60 do all 3 every day without realizing it. The first is hidden sodium. Not what comes from the salt shaker, but the sodium buried in everyday foods. Cheese, processed meats, canned soups, bread, condiments, takeout meals, frozen dinners. Sodium draws water out of your bloodstream and into your tissues. Your body retains roughly 4 cups of water for every gram of excess sodium consumed. Most Americans over 60 are taking in twice as much sodium as they realize. The second is sitting after dinner. The hours between 7 and 10 at night, when you finally settle into the recliner to unwind, are precisely when your legs accumulate the most fluid. 3 hours of stillness following your largest meal creates the worst possible setup for overnight fluid reabsorption. The third is alcohol. Even 1 glass of wine in the evening dilates your capillaries, raises the rate at which fluid leaks from vessels into surrounding tissue, and suppresses the hormone your brain uses to signal the kidneys to slow urine production at night. 1 drink and your ankles will be measurably worse the following morning. Now the other direction. Things that actively support lymph flow. Water. This is counterintuitive for most people. Those with swelling often reduce their water intake, assuming more fluid means more swelling. The opposite is actually true. Dehydration thickens lymph, making it sluggish and difficult to move. A well-hydrated body produces thin, freely moving lymph. Aim for roughly half your body weight in ounces daily, spread throughout the day and tapering off after 5 in the afternoon. Foods rich in natural flavonoids, which are compounds that reinforce the walls of small blood vessels and reduce leakage. The richest sources include dark berries, buckwheat, citrus peel, and red cabbage. A daily cup of berries has measurable effects on capillary integrity over about 8 weeks. Protein. This surprises people. Low blood protein levels, specifically low albumin, are one of the under-recognized drivers of tissue swelling in older adults. Albumin is the protein that holds water inside your blood vessels. When levels drop, water escapes into surrounding tissues and remains there. Many older adults are mildly protein deficient without being aware of it. 2 servings of quality protein per day, eggs, fish, chicken, lentils, cottage cheese, directly improves the physical dynamics of fluid balance. Magnesium, which is deficient in the majority of people over 60, plays a role in smooth muscle tone, including the walls of lymph vessels. Pumpkin seeds, dark leafy greens, and almonds are the most accessible food sources. Now the 5-minute habit that drains your ankles before bed. This is the core of everything I'm sharing today. Pay close attention. Every step counts. Morning. Before your feet touch the floor, while you're still lying in bed, perform 30 ankle pumps. Point your toes downward, then flex them up toward your face. 30 repetitions. Takes about 45 seconds. This restarts lymph flow after 8 hours of stillness and prevents fluid from rushing directly into your lower legs the moment you stand up. Daytime. Every hour you're seated, do 20 calf pumps. Heels on the floor. Lift your toes up and bring them back down. Or if you can stand, rise up onto the balls of your feet and lower back down 20 times. 30 seconds. This keeps the conveyor belt running through the day so fluid never gets a chance to pool significantly. Set a recurring alarm if needed. Before dinner, 5 minutes of gentle walking. Not exercise, just movement. Around the block, through the house, out in the yard. Walking engages the deep calf muscles in a way that seated ankle pumps simply can't replicate. Evening, 90 minutes before bed. This is the essential piece. Lie on the floor or on your bed. Place your legs straight up against the wall at approximately a 90-degree angle. Heels higher than your hips higher than your heart. Remain there for 15 minutes. During those 15 minutes, perform slow ankle circles 10 in each direction, then alternating ankle flexes 20 repetitions. Then, while still elevated, place both hands flat on your abdomen and breathe slowly and deeply through your nose, letting your belly rise for 3 minutes. Long, deliberate belly breaths activate the thoracic duct, the main drainage vessel of the entire lymph system, which runs directly behind your diaphragm. Every deep breath is mechanically pumping your lymph. After 15 minutes, slowly roll to your side, sit up, and do something simple but genuinely effective. Starting at your ankle, use the flat surface of your fingers to sweep the skin upward toward the knee. Slow, steady pressure, always directed toward the heart, never downward. 10 strokes on each leg. This is a simplified form of manual lymphatic drainage, and it physically encourages fluid from the tissues into the lymph capillaries. Shortly after completing this sequence, you'll feel the urge to urinate. You'll pass 300 to 400 milliliters of light-colored urine. That's the fluid that would otherwise have woken you at 2 in the morning. You've moved it while you were still awake and in control. Dorothy followed this protocol for 3 weeks. By the end of week 1, her sock marks were gone by morning. By the end of week 2, she was sleeping through the night. By the end of week 3, her ankles at 9 in the evening were the size they used to be at 9 in the morning. Her echocardiogram hadn't changed. Her medications hadn't changed. What had changed was that her lymph system was finally being given its working window at a time that fit her life, instead of scrambling through the night while she was trying to sleep. 5 things to do tonight. 1. Do the PIT test right now. Identify your grade. Write it down. 2. Cut one source of hidden sodium starting tomorrow. The biggest offenders for most people are cheese, processed meats, and canned soups. Choose whichever you consume most frequently and cut it out for 2 weeks. 3. Before dinner tonight, take a 5-minute walk. Not later before dinner. 4. 90 minutes before bed. Legs up the wall for 15 minutes. Deep belly breathing for 3 of those minutes. 10 upward strokes on each calf once you come down. 5. Tomorrow morning, 30 ankle pumps before your feet leave the mattress. Do this consistently for 2 weeks. Retest. The change will surprise you. One final thing. I want to know 2 things before you go. How old are you? Leave your age in the comments. The age range of this audience genuinely influences which topics I prioritize next. Right now the average seems to be around 75. And second, where are you watching from? Which city, state, or country? Drop it in the comments. I want to see how broadly this conversation is spreading, because it helps me understand who needs this information most. And if someone you care about has ankles that swell by evening, share this video with them. They've almost certainly been told it's their heart, and they've almost certainly been given a pill that doesn't address what's actually happening. You might give them the explanation no one ever bothered to offer. Your ankles aren't betraying you. They're a drainage system that stopped receiving the signals it needs to function. Give it 5 minutes a day, and the difference isn't subtle. It's the kind of change you see in the mirror, feel in your footwear, and notice the first morning you wake up without pressing your thumb into your calf just